Welcome back. If you're just joining us, this is Breakfast Daily. And of course, it's still Pink October. I'm sure that you've been singing the montage. And if you're wondering what Pink October is all about, it's the Breast Cancer Awareness Month. And right now we are getting into our health segment and we are going to be discussing breast cancer treatment. The other time we talked about mastectomy, but today we're going to be looking at hormonal therapy and breast self-examination. Well, I'm just the host of this show, but we have an expert here to help us, know more about the hormonal therapy and breast self-examination. So joining us in the studio this morning is Dr. Sophia Acheampong, medical doctor at the Kalabu Teaching Hospital. Hi.
Hi.
How are you?
I'm great, thank you.
You are welcome to the show.
Thank you so much.
Okay.
It's an honor to be here.
Thank you too. And then we have our model too, right? You're welcome to the show. Anyway, let's get straight into it. Obviously, we've been talking about breast cancer throughout this month because it's Breast Cancer Awareness Month. The other time we talked about mastectomy. Another doctor actually explained to us what mastectomy is about and at what point someone needs it. But today we are talking about hormonal therapy. How does hormonal therapy come to the discussion of breast cancer treatment?
Okay. As you rightly said, there are different modalities for managing breast cancer, and hormonal therapy happens to be one of them. And the way the therapies work is dependent on the stage of the disease and also the patient's individual factors. So hormonal therapy comes in for cases of breast cancer that are positive for have hormone receptors. Yeah. So hormone receptors are basically structures that are found on the surface of the cells. So these receptors bind to the hormones, so estrogen and progesterone. Right. And so if your cancer type is that which has the receptors for the hormones, this can be done through a test to know if it is receptive to the hormone. Right. That is when hormonal therapy can be used. So hormonal therapy cannot be used for every kind of breast cancer. It's specific for those that are hormone receptor positive.
Wow.
Yes.
So if you're not hormone receptor positive, you cannot use hormonal therapy.
Yes,
then maybe you have to look at something
other.
Wow. And are there different types of hormonal therapies that we should know about?
Yes, there are different types of hormonal therapies, and these are based on how the hormones work. So when they have the receptors on the surface of the cells, that means that these cancer cells are growing by having the estrogen binding to them. So the hormonal therapy is targeted at preventing the estrogen from being produced in the first place, or preventing estrogen from being from binding to the receptors. So the modalities or the treatments that are available fall within those categories. So it's either it's like the receptor is a chair and then the hormone comes to sit on it like a person sitting on a chair. So if we are giving you the medication that blocks the receptors from, we are giving you a medication that sort of takes the place of the hormone on the receptor, and so those hormones are no longer binding, and so it's going to prevent the rate at which the cancer is growing or to stop it from growing. Right. We can also prevent you from producing estrogen at all. Yeah. So that in that case, your ovaries, which are producing the hormones in the premenopausal women, are taken out. So it can be taken out surgically, or there can be radiation to stop it.
Stop it. Yes. All right, now, but estrogen is very important to women.
Yes.
To the development of women. So if you stop the estrogen, what happens? Okay. Does the person die?
No, the person doesn't die. The aim is to reduce the rate at which the cancer is growing. But some of these treatments that we have also mimic estrogen, in as much as they are blocking the estrogen from attaching to the receptor. They also mimic it, and so it's the other needs that you need estrogen for are still met. Right.
Yes. So well, obviously this is new to me. This is the first time I'm hearing this, and I'm sure it's some sort of medical evolution or innovation. But how long has this been happening here in Ghana?
It has been happening for a long time because hormone therapy has been in the works for a while, but the way that breast cancer treatment works, like I was saying, depends on the stage of the disease and also the patient's individual factors.
At what stage?
So hormonal therapy can be used in advanced stages. So if the cancer has already spread, and then surgery is no longer an option because now it's gone beyond the breast itself.
Wait, hold on. Pause on that. So you mean it gets to a point that if it spreads so much, they'll tell you no need for surgery again?
When it spreads beyond a certain point, there's no point in doing surgery because it has gone beyond the breast tissue. If it's localized, that is, it's still within the breast, where the tumor is can be resected as well as some healthy tissue around it, or the whole breast can be taken up. But once it spreads to the lymph nodes or it spreads to the lungs, other parts of the body, then surgery is no longer an option.
Wow.
Yes.
Wow. All right. So are there statistics of, how well it has worked, especially here in Ghana?
Okay. So I don't have the statistics for Ghana,
Yeah.
but worldwide with trials that have been done, it has shown that hormonal therapy is very, very effective at not only slowing down the rate of cancer, but it also even helps in preventing breast cancer. So in women who have a high chance of developing breast cancer, maybe a family history or other risk factors, hormonal therapy can be instituted even when the cancer has not been detected to prevent it from actually
especially
advancing.
for people who it's hereditary in their family,
Yes.
right? So if you're someone, maybe you're watching right now and there's been, history of breast cancer in your family, you might as well just start right now. Is that what you're saying?
Yes, but then the best thing will be to see your health practitioner, and that is why it's so important to detect it early. Early detection is the best because then it can be managed effectively. You can actually achieve a cure, but once it advances and then we are just dealing with managing the condition and not really curing it, because then it's gone beyond. So that is why we can't overemphasize the need for early detection, and that is why we are advocating for the breast self-examination as well.
All right, so let's talk about breast self-examination. It's actually an essential practice right now, but remind us, how should we go about it?
Okay, so for the breast self-exam, we want you to do it at least once a month. So, and ideally, it should be after your menstrual period, because prior to your menstrual period or around that time, there are like certain normal changes that occur in the breast. The breast get denser and
heavier,
tender and all of that. So we advise that you do it after. And
when you say after,
so
could it be like
a week?
A
week
okay.
after, yes. And we want you to get familiar with doing it. One doctor once said that as a patient, you are your first doctor. And actually, I think I agree with that, because you know your body. You are literally with your body all the time. And so you'll be the best person to pick up if there are changes, especially if there are subtle changes. So it's important to adopt the habits of the breast self-examination. So you want to check your breast every month for lumps, so if there's certain changes that you see, even observing the skin, if there are any changes in the texture, you notice there's some puckering, all of that, soreness, the nipple, the whole breast is important to check.
So why is it that Africans do not, are always late to the party? When I mean the party, we're always late to realizing, there's something in my breast. Would you say because we're not sexually liberated, we don't touch our breast enough? Like, would you say that?
Okay, I think that would be a factor, but I think education is also a problem. Not everyone knows what it is, how to go about it, and so we are trying to get the message out there.
Okay,
yes.
All right. So you have something here with you.
Yes.
Tell us about it.
Okay, so this is a breast self-examination kit.
So we have kits now?
Yes.
Okay.
So it's been around for a while, like worldwide, but in our part of the world, that is now being introduced, unfortunately. And it is just designed to increase the sensitivity. So as you're going to use your hands to palpate the breast, like as in touch it, and then feel for if there are any changes, if there are any lumps. But this, should I call it a device, is designed such that it increases the sensitivity of your fingertips to, for example, if you're going to put something like a strand of hair under this, and you're going to feel it, it's going to feel as thick as a wire.
Oh, wow.
So in a way,
right?
yes.
So a strand of hair under this will feel as like a wire?
Yes. yes. So it's designed to improve the sensitivity of, the fingertips. So what you do is you just place this over the breast like you normally. So let me demonstrate on. Okay, so could you please place your hand so on your shoulder like that? Okay.
So if I'm going to do it to myself, I have to do the same thing?
You do that, yes.
Right.
So you stand and then you want to expose the whole breast, because the breast actually extends.
Goes all the way to the
armpit.
Yeah.
So you don't want to neglect that area. And then you're going to put the pad on it. And then so just the same way you do if you didn't have the pad on, that's the same way. So you want to go quadrant by quadrant. So like you divide the breast into 4, and then you go through every area thoroughly. And then you not forget the tail, the axillary tail of the breast. That's the part of the breast that extends into like the armpit region. So you want to palpate that. So first you do that standing. So it's fine. You can.
So you have to.
Yes, you do that standing, and then you also do the same thing lying down.
Okay.
Yes. Then after you're done with that, you'd also want to look in the mirror. So that's when you're actually looking at the appearance of the breast.
Okay.
If there's any, you notice any dimpling of the skin. If you notice that
there's a sore.
There's a sore on it. If you also want to press the nipple between your thumb and your index finger to sort of like you're trying to express something out of the nipple to see if there's any discharge, because all those things are signs that there's something going on. But also I want to talk about the fact that if you do find a lump in your breast, you shouldn't be alarmed. It's not straight away that, oh, I have breast cancer or anything, because there are so many lumps in the breast that are also benign. So benign means that they are not cancerous.
I had someone that had a benign tumor and they took it out. Yeah.
Yes.
Now talking about the pressing the nipples. Yeah. Most times there are people that after they've gone through the childbirthing process, some of them still lactate.
Okay.
So how would you know it's just lactation or is something that I should be worried about?
Okay. So as a lactating mother, you'd be familiar with what your breast milk looks like, the texture, the color, and all of that, and the odor. So if you're having
odor,
yes.
Wait, there's an odor to this.
No, not necessarily an odor, not like a bad, but you know how it smells. So if you notice that, this time around the discharge I'm having is maybe a different color, it has a bad smell, or the texture is different. Once you're not sure, just go to your health practitioner, because they'll be the best people to tell you if there's a need for other tests to be done. Right.
Okay, but where can we actually find this device?
Okay, so this is currently available in a lot of pharmacies. So if you check, you'd be able to find it. And there's a website as well that you can check to find it, yes.
All right, we actually have some Facebook messages for you, actually.
Okay.
People are saying you're very knowledgeable. Dr. Sophie is on fire, so proud of you. Early detection is key. And as a patient, you are your first doctor. So people actually agree with what you just said. But what would be the last words you will have to share with us, especially for the fact that it's still Breast Cancer Awareness Month? And, well, the month has almost ended, but what will be the last word that you share with the viewers? Okay,
so the last words I'll share with the viewers is that it's so important. I mean, we all go around hearing, oh, Breast Cancer Awareness Month, get your breast checked. But how many of us are actually getting our breast checked? How many of us are getting our breast screened? How many of us are encouraging other people to get their breast screened? And so I would encourage everyone watching to make sure you get your breast screened. Make sure you encourage someone. There are lots of people who do not know anything about breast cancer. So if you have anyone like that around you, a younger person, or everyone, you should get your breast checked. You should check it first yourself. And then if you have any issues, or even if you don't have issues, just make sure it's checked by a professional so that you know that you are safe. Yes.
All right. So can we get this everywhere?
Yes.
In all pharmacies?
Yes, it's available. It's called the Aware Breast Self-Exam Pad. So,
all right, all right. Because I'm asking because, of course, the society we come from, we find it weird to do a lot of things like touching our breasts. So I'm sure people who don't like to touch their breasts would definitely need this. Yeah. Anyway, we've been talking to Dr. Sophia Acheampong, medical doctor at the Kolebu Teaching Hospital, and we've been talking about, breast cancer treatment. And today it's been all about hormonal therapy and, self-examination. Thank you so much. It was really nice talking to you.
Thank you.
I really appreciate you, joining us today. And of course, we have to do this to educate the people. And talking about education, I just want to add that it's important that you self-examine. Self-examine. Don't be afraid to touch your breast. It's on your body. It's nobody's body, your body. Don't be afraid to touch it, all right? Try to be your own doctor first before you go to the doctor, all right? Because if you keep quiet, if you refuse to touch yourself, something might be growing, no. All right. Anyway, guys, thank you so much. Thank you so much for joining us on the health segment today.